Fox News Alert. We have some big news this morning in the race for the coronavirus vaccine. The drug maker Moderna asking the FDA for emergency approval of its COVID-19 vaccine today. Here to react is Fox News medical contributor and author of that book right there, Make America Healthy Again, Dr. Nicole Saphier. Dr. Saphier, always good to see you. This is excellent news. Can you tell us more about it?
Yep, very exciting news this morning. Moderna has officially been going to file today their EUA from the FDA about their COVID-19 vaccine. They're reporting a 94% efficacy rate. But one of the more important things that they also said was that it was 100% effective in preventing severe illness, similar to the flu shot. So some people may get the flu vaccine and they still get the flu, but it does a great job in making sure that it is not the severe effects of the flu. And now it looks like Moderna is going to be doing the same thing with COVID-19, and that's just another way to keep people out of the hospital.
That's great. So the FDA is meeting on December 10th to talk about Pfizer. Will they also be discussing Moderna, or will that be a separate panel?
So it's going to be a separate panel. Right now, the FDA is reviewing all the information that Pfizer has submitted. And on December 10th, they're going to convene. And they're going to be doing a non-binding vote to see if it actually should get approved from the EUA or not. A couple of days before December 10th, we're going to have a good idea if it's going to be approved or not, as their staff report's going to come out. Also, one of the most important things about this process is they're going to be submitting the documents online. So it's available for public commentary. That is crucial to get rid of some of this, some of the skepticism that's being present with the public right now. So it's really important that this process is transparent, which it's going to be.
Okay, I know the CDC is also going to meet this week to discuss who is going to get vaccinated first. We'll, of course, be reporting on that. I'm sure we'll have you back on to talk about that. All right, this is Dr. Celine Gounder. She is Biden's advisor. She is on his advisory board, his COVID advisory board. Listen to this, Nicole, and we'll get your reaction on the other side.
We fully expect that in about a week or two after Thanksgiving, we will see an increase in cases first. Then about a week or two later, you'll start to see an increase in hospitalizations. And then another week or two after that, you'll start to see deaths. And so unfortunately, that means that many people who celebrated with family, with friends over Thanksgiving will find themselves in the hospital, in ICUs over Christmas and New Year's.
Dr. Saphier, Dr. Birx even said, assume you have it if you traveled for Thanksgiving.
So that's right. So Ainsley, you know, I've been saying now for a couple months that I feel like I should be a translator for Dr. Fauci and now Dr. Gounder, because although everything that she is saying is 100% true, we also have to make sure that we are not pushing the American people farther away from wanting to adhere to some of these recommendations. Dr. Fauci said last month that maybe we should cancel Christmas. I mean, that is the most ridiculous thing possible. There are many safe ways to be together for Christmas. While I do agree that we had over 9 million Americans travel during the Thanksgiving time, that will undoubtedly result in a rise in cases, which will result in a rise in hospitalization and will also result in a rise of deaths. I think it's important to remind people the reason that we're doing this. We have uncontrolled spread of the virus throughout the country right now, and although the far majority of people will not end up in the hospital and will not die from this, this is still a very deadly virus. We have a few more months of this. We have Pfizer is likely going to produce 20 million vaccines for Americans by the end of 2020. Just give it a few more months. If you did travel over Thanksgiving break, I do recommend just assuming that you have the virus. I recommend assuming everyone has the virus right now. I think I've been saying that to the spring. Do what you can. Wear a mask when you need to. Wash your hands. If you traveled over the break, I would consider getting testing right now if you don't want to self-quarantine for 10 to 14 days. And just know there is a big light at the end of this tunnel.
Yes, Christmas is around the corner, the birth of our Savior, and then also these vaccines. It's great news. Thank you so much. Dr. Saphier, we appreciate having you on.
Thank you, Ainsley.